Hello, everyone. Thank you for joining us today or tonight, depending on where you're from, for our live broadcast. And today we can finally shout it from the mountaintops. It is World Thrombosis Day, which we're super excited about. We have a very special guest today, which I'm really excited to announce and introduce. And we have another guest returning to our live. So let me just get started. I'm your host, Dr. Ariel Dance. In addition to hosting our World Thrombosis Day Facebook Lives, I'm also a multiple blood clot survivor in my 20s many times. And so I'm super excited to still be alive. And this is the day that we celebrate still being here. So super grateful for that. As I mentioned earlier, today's a special day, not just for us because it's World Thrombosis Day, but because we are joined by an extremely special guest, YouTube star and U.S. World Thrombosis Day patient advocate, iJustine. So super excited. Hi, iJustine. So excited to have you.
Hello.
You may also
Thanks so much for having me.
iJustine. I think that some people may be here and only know you by that name, so I feel like we should go either way. So iJustine, I'm just going to read like your little bio. Is that okay? Unless you want to like
go for it.
Yourself. I'll do it.
You got this.
iJustine is one of the top female tech personalities on YouTube right now with over 1 billion views and 7 million followers. And iJustine starred on the YouTube comedy series Annoying Orange. In 2016, she was an advisor to Arnold Schwarzenegger on the reality competition series, The New Celebrity Apprentice. Her television acting credits include guest appearances on Law & Order SVU, Special Victims Unit, The Bold and the Beautiful, and The Vampire Diaries, which we've all been geeking out about on the team. iJustine also appeared as the main character of the YouTube premiere murder mystery reality series Escape the Night. So iJustine, welcome to this year's World Thrombosis Live. We are so excited to have you. And would you like to say a few words before we really get started?
Yeah, I mean, I'm so excited to be a part of this, but also when you think about it, I'm like, this is the craziest thing. 'Cause earlier this year, I would have never even known what World Thrombosis Day is. So it's kind of unfortunate, but also fortunate that I am in this position to be able to share my story with my viewers and with people outside of that, and kind of connect with other people who have been through the same thing. And even a part of my healing journey was connecting with other people who have had this or who have had something similar, and able to share experiences and get suggestions on healing. So I'm just super grateful to be here and grateful for my audience that they've been so supportive. I can see all of their comments coming in. So thank you guys all for coming to hang out with us.
This is so awesome. And I can't wait to talk a little bit more about your journey and your experiences. I watched, a few of your YouTube videos specifically about your health journey. And I was like, oh yeah, me too. Oh yeah, that was me too. So I can't wait to talk a little bit more, but I cannot do it without acknowledging that we have Dr. Jean Connors here with us today. But Dr. Connors allowed me to just call her Jean, so we will go by Jean. So we have Jean here with us, who is the medical director of anticoagulation services at Brigham and Women's Hospital and Dana-Farber Cancer Institute in Boston, Massachusetts, in the U.S., and an associate professor of medicine at Harvard. She is also a member of the World Thrombosis Day Steering Committee. So super excited to have you here, Jean. And I want to also give you a chance if you wanted to say hello and welcome.
Well, hello, and I'm delighted to be invited back this year again to pair with you, Ariel, as a great patient advocate for World Thrombosis Day, and bring along Justine. I think both of you have very compelling stories to tell. And I think it's great that we're bringing this public awareness campaign and letting people really know that clots happen. And they can happen to not just, the older patient sitting in the hospital, but to young, active, very healthy patients. So thank you for inviting me today. And thanks to the audience for helping us celebrate World Thrombosis Day.
Yes, so excited. And then I feel like we should maybe explain what World Thrombosis Day is, or at least what a thrombosis is. So I'll just give a little background. So today is World Thrombosis Day, happens every October 13th, and we're placing a global spotlight on thrombosis, also known as blood clots. It's an urgent and growing health problem. So we know that 1 in 4 people globally are dying from this condition, any conditions related to blood clots. And so World Thrombosis Day campaign raises that awareness, empowers patients, provides recovery resources, and works with healthcare professionals in more than 125 countries to educate their communities about the signs, symptoms, and risk factors. So World Thrombosis Day, as I said, is taking place on October 13th for a specific reason. It is the birthday of Rudolf Virchow, who is a German scientist who developed the concept of thrombosis. So today is his 201st birthday. Happy birthday, Rudolf. Super happy for you. And thank you. And Jean's really good at kind of explaining a little bit more about all of the goodies about like how we know thrombosis works. So if you want to get into that, we'll talk about it in a minute. But also, in addition to celebrating Virchow's birthday, today, World Thrombosis Day is the day to recognize and strengthen our resilience as survivors of blood clots around the world. And so the experience of having a blood clot can be so difficult, physically on the body, which, Justine, you're going to talk about that, but also emotionally and mentally. And I hope we get to touch on that as well. And so we want to recognize all of our survivors. If you're here, please drop who you are in the chat, where you're tuning in from, because we love to celebrate the fact that you're still with us and you're still alive. So because today is World Thrombosis Day, we're excited to have both iJustine and Dr. Connors with us. Plus, we are giving away 2 $50 Apple gift cards during the broadcast in the comment section. And we'll also give out some t-shirts following the live. So please pay attention to the clues, put your name, be interactive in the chat so you can get all the goodies today. And we invite you to be as active and involved, ask all the questions, and we hope that we get to as many as possible. All right, that was housekeeping. Let's get started. So I'm going to start with you, Justine. Again, thank you for being here with us. But earlier in the year, you shared your blood clot stories with millions of YouTube followers. Can you tell us a little bit about like what happened and how your viewers have helped support you through your journey?
Yeah, so it was actually April 1st So I was hoping that that was, like an April Fool's joke. My body was playing on me, but unfortunately it was not. But earlier in that week, I was at an event and it was weird because I felt like super tired, like a tiredness that I'd never felt before. So my first thought was like, oh, I probably have COVID. So I took COVID tests all that week because I didn't want to go to this event if I was contagious or something. So I kept coming up negative, negative, negative. I'm like, okay, well that's weird. Maybe I'm just tired from interacting with people, or maybe I'm tired from my workouts. And then my arm started feeling weird. And I texted my sister, and sometimes that can be a little bit dramatic. So when I told my sister I had a blood clot, she was like, slightly concerned, but she's like, well, if something happens, like I'll take you to the ER. And instead, I took a shower. It felt like the swelling went down, and I continued on my day. I went to dinner, went to events, and then it was that Friday. So maybe like 2, 3 days later, it felt like it was getting worse. Actually, it was Thursday night because then Friday was when I went actually to the hospital. And I woke up that morning and I was like, something is definitely wrong. Like I got up at 5 a.m. We were supposed to go do this podcast. And so I went, packed all the gear, and I was like, I can't even bend my arm to dry my hair. And it was just such a surreal experience because it was like a part of my body was like not functioning the way that it should. And there wasn't a lot of pain. So normally I feel like you associate pain with something being wrong. So I kept thinking, well, this doesn't hurt, so I must be okay. But then when I started seeing like the blood vessels start breaking in my shoulder, I was like, okay, this is not right. And then my arm started turning purple. And so I went to the like an urgent care. And when I showed the woman my arm, I was like, I think I might have a blood clot. She looked at me. She's like, we're not equipped for this. You got to go to the emergency room. So she started freaking out. And then I was like, okay, if she's freaking out, I should start freaking out. For some reason, I didn't really freak out. I just told my sister, I was like, we got to go to the ER. So we went. I went in, basically told them I think I have a blood clot. They looked at it and, they got me admitted pretty quickly and did the ultrasound to confirm that, there was a clot, got me on the blood thinners, and then said I needed to go to another hospital that was more equipped to do the, what's it? I don't want to pronounce it wrong because I know there was like the thrombectomy, which which they kind of like poke it out. And then there's like the what's the other one?
So there's thrombectomy where they go in with a catheter and they actually pull the clot out and extract it.
Yeah.
And then there's catheter-directed thrombolysis, where they put a flexible catheter in the vessel and they deliver through continuous infusion for 12, 24 hours usually, a drug that dissolves clots called TPA.
So that's what I had. And it was actually, it was super scary, especially because my sister's a pharmacist. And then when I called her, she ran me through all the risks, and so then I'm like sitting here, well, actually laying in the operating room before they're ready to do this procedure. And the only thing that I know are the risks. So I'm freaking out. And then we actually have another YouTuber friend who's a radiologist also that does this procedure. So we literally had one of my friends on speed dial who was also like walking me through this. So I was super grateful to have somebody who was, a close friend and also a doctor that does this, to be like, look, this is what I normally would do. And he's like, if I was you, like if you were my patient, this is what I would do. So that was super helpful to kind of have, my sister and a friend to kind of walk me through this because, sometimes I think it's really difficult for a lot of doctors. They don't really have that kind of bedside manner to make you feel comfortable. And so, the doctors were all great, but I was like, you're not explaining to me like I'm a 5-year-old what is happening. And that's what I need right now.
Yeah, I just want to jump in for a second and say that your ability to be so proactive for yourself and your health and actually recognize that you might have a blood clot, I think makes a huge impact and difference, because I've seen many cases where people have had maybe not as dramatic swelling, but they have swelling in their leg or they have chest pain, and they go to the emergency room or they go to an urgent care center, and the doctors or the nurse practitioners or the physician assistants don't really think that somebody your age could have a blood clot. So you get a lot of credit in my book for recognizing that you might have had a blood clot or a blood clot might be forming. And I think that's very important.
Yeah, I mean, I think I'm very lucky too because my mom is, she's very health conscious and knows a lot about the medical field as well. So like anytime we were growing up or anytime we would be going on flights, she would always make us wear compression socks and always like warning us of blood clots. So like in the back of my mind, anytime I get off of a flight, I'm like, do I have a blood clot? So it's like that has always been something that's been ingrained since I was very young. So the fact that I kind of had that knowledge and already kind of just felt like that's what it was, I'm super grateful because I think, maybe somebody, I mean, it was so purple that no one would have been able to ignore me at that point because it was not cool. It was like terrifying. It was like I looked like I had this massive bicep. I was like, did I like go a little extra hard at the gym? I'm not sure. Like it was not normal. So I definitely knew something wasn't right.
So you're actually bringing me to one of my main questions for Jean. Jean, how common is it for blood clots to form in the arm? We talk a lot about blood clots in the lungs automatically, or I've heard in the groin, I've heard in the leg, but the arm seems to be less common. I don't know.
Yeah, no, the arm's less common because it has less effects of gravity, quite honestly, compared to your legs when you're standing up. And so the clots that tend to form there are either because people might have an IV in or a long IV or something called a central access catheter, or people like Justine, and I'll let her describe, what ended up causing the clot. Lots of upper extremity clots, as we call them, clots in your arm, the upper extremity, happen to people who do a lot of repetitive motion type of things like sports, or I've seen carpenters who do a lot of hammering over their head. I had a woman who was a bartender who had the glasses were always above, and she also had a catheter, but she kept reaching and then her arm swelled up, and not as dramatically. And again, she had a clot in her arm. So we do see it commonly in athletes as well, long distance baseball players, so long distance swimmers and baseball players and things like that, where sometimes it's the muscles that swell up and compress the blood vessels. Virchow, I have to say, because this is what I do for a living. Virchow actually was responsible for identifying 3 components that result in causing a blood clot. Something is called stasis, where the blood flow is interrupted and it slows down. The second might be an underlying hypercoagulable state. For some reason, people may have an easier ability to clot because of what's in their blood. And the third thing is often trauma. So people have various components of those, but long distance swimmers and baseball pitchers who are repetitively pitching, their muscles can sometimes swell and compress the vein leading from, bringing the blood out of their arm into their body. Justine had a unique condition as well that we see, and that should be suspected in people who have an arm swelling and a clot in their arm.
And also something that, I found interesting in my research, you can kind of talk more about that, but there's like a few different types of thoracic outlet syndrome. There's like the artery, there's the vein, and like there's different, and the nerves too. So I met a woman who had the nerve thoracic outlet syndrome, and she recommended me to one of her physical therapists. So I was doing physical therapy for like maybe 2 or 3 months, and it seemed to kind of help because it was sort of like opening up the muscles and doing that kind of stuff. But my physical therapist, she's like, I want to be honest with you, because this is the vein type, I want to be very careful, because with the vein, you can tell if you are getting better because you can have that sense of pain where I don't have that. So she's like, I'm a little nervous to continue working on you once you're off the blood thinners because we won't have that extra kind of barrier of protection. And but I was just reading in some of the comments too, and Ray was asking if blood clots are more common in females, or is there kind of any
so it's kind of interesting because if we start at like age 0 or 1 and we go up to 60, women have a little bit higher incidence of having blood clots occur around age 30 and a little bit on either side because of pregnancy, which is a very high risk, a very hypercoagulable state. Taking combination estrogen, progesterone, oral contraceptives, the estrogen component really increases your risk. But then as aging goes on, men have a much higher risk. Everybody's risk really starts to increase at age 60. And so, when somebody's over the age of 60, people in emergency rooms tend to think more of blood clots, which is why I think it's very important that both of you are such great patient advocates to bring awareness to the fact that young people can have clots.
Yeah, I've talked to a bunch of other like athletes. So I met a tennis player, which she was actually even younger than me, and she had the same exact thing. Like you said, baseball players, swimmers, like it runs the gamut of people that I've met because of this, and sort of that athletic kind of scenario too. And for me personally, for anyone that doesn't know, I previously was doing a ton of martial arts and also like sword training. And then we also kind of transitioned that into lightsaber training. So it was a ton of just repetitive, just, spinning a lightsaber and fighting. So, I would do that maybe 3 times a week and then kind of practice on my own. So it was a lot of that. And I mean, I think that's really the only thing that I can kind of say would have a factor that would kind of play into that.
Yeah, and that's, I think from what I understand, you've had what we call thoracic outlet syndrome, where one of the ribs presses on that bundle of nerves or artery or vein that runs through that small space, and the space can be smaller from person to person. And so again, I've seen competitive rowers that have this same problem, and some of them often need surgery to decompress that area. Because the vein sometimes gets scarred, and that's a whole nother story. But yeah, thoracic outlet syndrome is very common in young people who engage in the types of sports that you were doing, Justine.
Yeah. And, they told me if I want to kind of get back to doing those things, like I should have a rib removed. So even now I'm been super cautious. I haven't really been doing that as much. And even when I do like yoga or some kind of like overhead lifts, like I start feeling a little weird. So I start getting nervous. I'm like, is this happening again? I don't know. And so it definitely is in my future plans to, assess and get this rib removed, because I just feel like obviously this is something that will help me in the long run. And obviously I would rather do it now while I'm younger and not wait until something, happens. But, I feel like I've already kind of push my limit of how much time I should wait, because it really is scary. And I think it's something that I do think about every single day. And I just got back from a long trip of traveling. So it's like that whole time when I was traveling, when you're on long flights like that, that's also, that's high risk. So it's something that I think even a lot of other survivors here can attest to, that like it doesn't leave you. You're always thinking about it. Even if you feel good, you're just like, well, what if, you just never know.
So true, Justine. So true. So we have some really good questions coming in. We're going to do a giveaway. Why not? So I'm going to take a question from Eric and from Louise. And if you'd like your t-shirt, you should private message the World Thrombosis Day Facebook account, Eric and Louise. So thank you. So Eric's question is, does a person's diet have anything to do with getting a blood clot? I'll throw this to you, Jean. And Eric is saying they've never had a blood clot before. So they're just asking.
No, it's a great question, because the short answer is no. There are really no diet component to getting a venous blood clot. For different types of blood clots, I have to be honest, like stroke and heart attacks, then we get into the whole cholesterol type of impact in your diet. But the type of clots that both Ariel and Justine had have nothing to do with diet.
Yeah, and something else, whenever I went on the blood thinners, it was like the first thing that I thought was like, oh, do I have to change my diet because of this? And like, because there's various types, like sometimes, yes, you do, but it was just a whole kind of learning curve. And something else that was kind of interesting that came out of all of this is, for me, the pain that I felt of caffeine withdrawal, it was way worse than the blood clot pain. So since then, I've just kind of stayed off caffeine. So people think that I'm not allowed to drink it because of the blood clot. And that's not the case at all. That was merely a personal decision. But I feel like that has kind of helped me in the long run, because I do feel like when I was drinking coffee, I would always feel anxious. I would have heart palpitations. And it's like all of that has gone away. So that has helped me even just sort of in an overall kind of sense of my well-being.
Mm-hmm.
Yeah, no, it's when people have had a blood clot, then as you both have said, there's some anxiety about, is it coming back? Is this new pain related to a clot? Am I getting another one? And so the diet question comes up: is there anything I can do to prevent it? In that respect, diet is not one of the key components. As Justine mentioned, there is an anticoagulant called warfarin, where you have to be very careful about the vitamin K containing substances, green leafy vegetables, and stuff like that.
Thank you both. So Louise's question is, Justine, have you found that as you tell your story, that people are typically not aware of blood clots? And have you also found that many people have similar experiences?
Yeah, I've definitely have found kind of both scenarios where people will either say, "Oh my gosh, like I've either had one or I've have a relative or like an older relative or something like that," because it again, it does commonly affect older people. So when you hear these stories of younger people with them, it can be kind of shocking. And I think it's been great to be able to educate, and even just kind of reading through the comments after I posted stuff on like TikTok and all of those kinds of things. I think there's still so many misconceptions. And, like you said, talking about like birth control, because a lot of younger and younger people are starting on birth control at earlier ages. And I think that's something that like people need to be aware of, because I think a lot of people don't know. They just think, oh, I'm on this and everything's going to be fine. So I think that's something that's been important for me to kind of alert people. And just for the record, like I was not on birth control. I am not. So that was not a contributing factor. And I think there's a lot of other things that people like to think that they know why this happened. Like it has been proven that this is purely anatomical for me. Like my rib, like I saw what was happening. Like I have all of the CT scans. Like I can see the blood. I can see where my rib is, and it's pressing on that whenever I raise my arm. So I think there's a lot of things that can cause blood clots. But for mine personally, it was an anatomical, and in my medical records, it says I'm basically a Jedi. So I love that every time the doctors would come in, they're like, "So how are you feeling? And we also need to talk about something." And I was like, I get scared. I'm like, "What's wrong?" They go, "Lightsaber training. What is that?" I was like, "Oh my gosh, I've made it." Like in my medical records, Jedi.
I love it. It's funny that you brought up the birth control, concept and how it can be, it's known. People kind of know now, I think, that birth control can have a link to blood clots. I was on birth control when I had my blood clot, but I also had recently had surgery, and I was also, found out I had like a genetic mutation. Whole lot of things were happening, but I think you do speak to kind of like, what do we know and what do we still need to learn? And but I love telling people like the warning label on birth control is real, specifically to young people, because I'm like, we have a lot of us were on birth control in our teens, and we're taking it still into our 30s, and I'm like, just letting you know, like, just be careful, because it happened to me and it could happen to you. And you just, I think sharing your story is really what does it. So even people just knowing that it's a possibility for them, and knowing the risk factors, knowing the warning signs makes all the difference. I've seen so many lives saved just because they said, I think this is that thing Ariel was talking about. And then they went to the doctor and was like, oh, I have it. I have a blood clot. And it's like, yeah, I'm glad you went to the doctor, because I wasn't just talking like, out the side of my neck. It was like real scary stuff happening. So keep
Yeah.
sharing your story. This is for everyone. Share your story all the time. You're going to save a life, I promise.
And another thing too is knowing what's normal for you, because I have a pretty low blood pressure and a pretty low heart rate. So when I was at the doctor, my sister was also there too. So she was just absolutely incredible. I mean, I couldn't use either of my arms. So she was like feeding me, like changing my clothes, like brushing my hair. She even brought some dry shampoo and gave me a little hairdo the one day. But she also knows like I have a very low blood pressure, low heart rate. So I was having kind of like a weird kind of, it wasn't like a pain, but I felt something strange. Like it felt like I could actually feel like I felt the clot like moving to my lungs. Like I don't know if I was like making it up, but like something felt weird. And then at that time, like I felt my heart kind of speeding up a little, and I like looked at the all of the machines that was hooked up, and I was like, okay, so my heart rate's a little bit higher than normal. Then they took my blood pressure and they're like, it's normal. I go, that's not normal for me. And my sister goes, absolutely not. That's high. That is high for her. And so they then took me down and did a CT scan and then found out that the clot did end up traveling to my lungs. So it was like those things that I was like, am I crazy? This is normal, but for you, it's not. So I think just, I think run into like your local, like Walgreens, CVS, whatever your pharmacy is, and use one of their blood pressure machines and just, every once in a while kind of figure out like what your normal is for you, because what your normal might be for others, it might not be for you. So I think that's just one piece of advice I think that is really important for a lot of people.
I love that. And that's so true. I know for you, Justine, you're really into like technology for your health. And I think that helps a little bit also with like knowing what your norm is, because like we have our Apple Watches, people have their Fitbits, and we look and we can see our heart rate. So all day I'm paying attention to like what my norm is. So what are your current like health devices, health technologies that you're really working with to like stay on top of your health right now?
Yeah, there's it's called WeThings or Withings. I always mispronounce it, but it's WITHINGS, and they have like blood pressure, they have scales, and they have like a thermometer. So those all connect to my app, so I can just do a little temperature check. I can do my blood pressure. It all syncs to my phone, and then of course I have the Aura Ring, and I've lost my AirPod, and so I've been wearing the Aura Ring pretty much every day since August. Now it is mostly a sleep tracker, but it does do consistent body temperature. It does blood oxygen levels, and it also does like heart rate too. So I have all of that data in addition to like my Apple Watch, which I pretty much wear all the time. So it's like my Apple Watch has like 8 or 9 years of data from my heart. So it's like I have so much information, and just being able to have that is great. But I think really even just having a blood pressure cuff so that I'm able to just, if I start feeling a little weird, go test it. If I'm feeling perfectly fine, test it, so I can just at least kind of know what that is. But those are kind of my main sort of health tech things that I usually use.
Yeah, I think you speak to knowing your baseline, right? And it is so easy now with all the tech we have for people to sort of get an idea of what their baseline is, because I think it's great. There you were sitting in the hospital and having a heart rate monitor and seeing your heart rate go up, right? Because often those things get missed, and it's and you probably did feel the symptoms. It's very interesting talking to people who've had clots that have clearly migrated. So again, knowing your baseline and not being afraid to bring up symptoms, I think, is the biggest piece of advice. To both of you are saying, go see healthcare providers if you have new symptoms or something that doesn't seem right. Because sometimes the symptoms can vary from person to person. So an arm or leg can swell up, it can turn purple, it can turn blue, it can hurt. It doesn't have to hurt, as your arm, Justine. But pulmonary embolisms can be a little different. And so I'm wondering, Ariel, what kind of symptoms you had with your pulmonary emboli, because they're not always the same. And I can tell you, I've heard a lot of different stories where when they were first told to people didn't even, pulmonary embolus was not the first thing that the doctors thought of.
Yeah, so I thought I was having an asthma attack, and then I also thought I had gas. So like it was like a gas bubble in my back. So I was taking like medicine for that, and then I was taking my inhaler, but I couldn't lay back. I couldn't sit back in a chair. I couldn't do anything. It was just like sharp pain between my back and then the shortness of breath. And so yeah, those are my primary symptoms. But then I heard Justine's, and she was like, yeah, I just kind of feel like pain. And then I was like, they didn't even have to put her on like oxygen. Like I was like the 25-year-old with an oxygen tank. Like I was like, you're so lucky. I was like, but that was my primary thing. Like I was just clots galore. So yeah, that's kind of what it felt.
No,
I was not breathing.
Back pain is not what people usually think of because people say chest pain and not back pain, right? And so the shortness of breath, if you have asthma or if you have other people think they have a cold or because they have a cough, but nothing's coming up when they cough. And cough alone can sometimes be a sign of pulmonary embolus. So not to worry people, but to be aware that if something doesn't seem right, that a blood clot is possible.
And it's also interesting because like I thought I had asthma for like the past couple of years. I would just get a weird cough. So I'm wondering if like I haven't kind of had this chronically, if maybe some of them have just been kind of cruising through and thankfully making their way, because it would be so weird. I'm like, I don't really have asthma. I don't know why I have this weird cough. Like it wasn't making sense. So that whenever I found out that that was also something, I was like, have I been having this for a while? And I didn't even know. And I've just been very lucky. Is that a possibility?
Yeah, well, so one thing that it absolutely is a possibility that people have clots and they're not compromised. That's the buzzword we use. So they still get enough oxygen. Their heart rate doesn't go up enough. They're not dizzy or lightheaded. But sometimes they can have a clot, and we pick those up on CT scans when they're done for some other reason. Or in your case, the CT scan that was done should have picked up any old clots versus new clots. And what I often do, my dog's acting up. What I often do is, once I've decided someone's had enough anticoagulation, I will get a repeat scan if we're going to stop, so that we know what the new baseline looks like, in case, because sometimes clots can persist, and we call them more scar type clots. But it is possible that you had small ones and they dissolved on their own.
Yeah, it's super scary because you really don't know. And it was weird because like it felt like the coffee anxiety feeling that I would get like when I was drinking coffee. So like that's kind of what it felt like. And so I was like, I'm not on caffeine. So like that's not it. I just sort of felt, it's like you felt the anxiety feeling, but I was like, I'm not feeling anxious. It was like I could just feel it kind of traveling. It was so weird. And it was just like, I told my sister, I was like, I really think something's wrong. She's like, well, we got to tell somebody. So I did. And it was weird because it's like this whole time that I was in the hospital, like, I don't even know how to explain it. It was kind of like I was just like completely blacked out, but yet I was like super pleasant and like being friends with everybody and just trying to make, I guess, the doctor's experience, like when they came in, like fun. So that, I don't know, it was just like, it's a weird thing because it's like, you want to be treating the doctors as nice as possible too, because like they have your life in their hands. And it's like, it's such a weird thing because it's like, I want to have that connection with these people. So it's like, I want them to talk to me. I want to be able to talk to them. So I don't know. I'm just so grateful for the incredible care that I had, that I was like, I just want to be so appreciative. And just, I wanted to hug everybody because I was like, you guys are literally saving my life. And like, I couldn't be just more grateful to be in such great care.
We're happy to hear that. Shout out to the audience. If you have great care, please tell your providers that you really appreciate them. So yeah, no, there's a lot of, in the moment symptoms with pulmonary embolus. And when people are first diagnosed, it can be overwhelming. And then as it sort of settles in, it comes up the question of, well, what caused this? Sometimes we never figure that out. So it's great that both of you seem to have an idea, Ariel, the surgery, and Justine, the lightsaber Jedi level of training. But I can imagine that many people aren't aware. And in some cases, we can't figure out what caused it.
Mm-hmm. I want to go back a little bit. Justine, you started using words like anxiety and fear, and then gratitude and appreciation. And so I wanted to kind of transition us into the not so physical side of this experience for you. We recently had a live specifically talking about our caregivers and the importance of having a support system. And someone said that your sister may actually be here, and you brought up your sister a few times, so she may be watching. So hi, sister. Hello. Thank you so much for all you did for Justine. She's really grateful, so I hear. But can you tell us a little bit about like what that experience was like for you, either the emotional side of it, or either how it's been, or if you just want to talk about like what your support system has been like.
Yeah, I mean, my family has been super supportive. They may be watching because they're actually downstairs right now. So I was like, you guys have to be quiet. I'm on a live stream. And our little niece, Bryn, she's 3 and she's wild. So, so she's probably tearing the house apart. But yeah, no, my family's been super supportive. And my sister, we live pretty close to each other. So she basically was like picking on me nonstop and just, definitely everyone has been super supportive. But I think the recovery process was so crazy just to go from, it was insane because I felt like I was in such good shape. I was like running, I was doing all my weightlifting, and I finally like got back to like where I felt great. And then I was like, this doesn't make any sense. Like, how did this happen? And then I basically couldn't even work out for like a month. And then I was just like feeling depressed. I was feeling sad. And like I was supposed to go on a trip to Hawaii that week. So then, everyone went without me. And I was just like, because I couldn't travel. So it was just tough from, going to basically living a sedentary lifestyle for a month, not being able to do my martial arts, not being able to do, not being able to run. And it was like all of the kind of coping mechanisms and kind of activities that I found through COVID, because it was like a lot of the stuff that I couldn't do through COVID. Then I became a runner, and I'm like, well, now I can't run because I can barely, like, I can't breathe. And when you're on blood thinners, for anybody that doesn't know, that's also a huge risk, because if you get cut or you fall or you get bruised, you hit your head, like you could potentially have internal bleeding. It's preventing your blood from clotting. So if you get cut, like you're not going to clot, and then you can bleed out. So it's like I have all of these things in my mind. I'm like, what if I go for a run? Am I able to drive in the car? Like, what if I get hit by something? All of these wild things. So it was just like an emotional roller coaster. And, I watched a lot of TV. And then there was one point where I just kind of was like, all right, I'm going to take this opportunity, because there's not many times where like nobody's bothering me to do work. Like I can actually watch TV and I shouldn't feel guilty. So I really leaned into that, watched a lot of TV, and, took like that first week before I even told anyone what happened. And then finally I told everybody, like the internet. And then, everybody that I think I've ever worked with, like all of the brands that I'd worked with, like everyone was sending me food and flowers and gifts. So I was like super just grateful and overwhelmed by like all of the support, publicly, privately, and just, I don't know, it kind of like just made me feel really great to just, know that I have such an incredible support system. And again, Jenna, my sister, who may be watching, just super grateful for her, because she was like literally there like 24/7. I mean, she was in the hospital. I was like, you have to go home. Like you can't stay here. I'm good. I'm fine. So yeah. So definitely very grateful for everyone. But it's still, it's just such an emotional roller coaster. And as you know, it's just like that recovery, like you think you're okay. And then like, it doesn't make sense. I'm like, why can't I do what I just did like last week?
Yeah. Jean, I have a question for you to follow up on that, but I'm going to pause to say giveaway time one more time. Well, not one more time, but again, for the audience members, shout out your support system. I want to know, who's taking care of you, who helped you out during your clot experience. So this is specifically for our caregivers out there and our survivors, to shout out your caregivers. Who is in your support system? Give them some love in the chat. So Jean, as a follow-up, how do you engage your patients about their mental health? Do you have any specific resources that you like to share, or words of wisdom and comfort during this experience?
Yeah, no, this is part of the, I often see people after they're diagnosed, right? So they come to my outpatient clinic, and the first visit in the first month is the barrage of, why me, and what does this mean? And as both of you know, oh my gosh, I'm on anticoagulation. What can I do? What should I not do? I will put in a plug for Medic Alert bracelets, which, thank you, Ariel. I mean, it's important, and they're not what they used to be when I was growing up, those little metal linky bracelets. They're actually very sophisticated now, and they don't look like Medic Alert bracelets. But I think it's very important for you to carry something with you, letting people know. And that sort of segues into your support group. So often, I find that patients want to talk about it, most patients, and patients that are worried about things we've sort of already touched on. They're worried that any symptom they have might be a new blood clot, and how do they figure that out? They worry, if they go off anticoagulation, is it going to come back? And so I direct them towards resources that are available in a lot of different areas. The World Thrombosis Day.org website, the Stop the Clot website, NATF. There's a lot of things out there. But I think talking with patients, I show patients their scans. So I show them their pulmonary embolus scans. We go over their ultrasound of their leg or their arm, and we talk about symptoms, and what is a recurrent symptom versus what is something they shouldn't worry about. I'm fortunate enough to have a lot of providers that work with me, nurses, pharmacists, nurse practitioners. And so as part of our anticoagulation management service, we have a hotline basically where they can call somebody and ask about the symptoms that they're having. So I think it's very important, whether you have a large support group like Justine might have, or, you know, one or two or three, you know, close friends that know that you have a blood clot and have some anxiety, but very important to bring it up with your physician, because I know it can be PTSD like for many patients in going through, you know, as you said, Justine, I know people who've had blood clots due to air travel, right? And then some of them are like, oh my gosh, am I going to be safe on the plane? And so we talk through how to make them be safe on the plane and decrease their risk for getting another clot. And I think that's key. I will say that if you don't bring it up with your provider, they may not be aware that you're having stress. And so although you can get a lot of support from groups that are out there, there are some Facebook support groups. Both of you are doing a great job bringing awareness to blood clots. And then there are the support materials that I discussed. But your provider can also help. You just have to let him or her know.
Yeah, I think it's great too. Like there's so much telehealth now that, you know, you have the ability to just, like, I can just text my doctor essentially. And then it was interesting because I had made an appointment. I have another, I don't know if it's called One Medical. So it's like basically like a doctor prescription kind of thing that I had got like a few years ago when COVID happened, because I was like, I don't even have a doctor. So that was like my first thought. I'm like, well, how do I get one? And then also I'm super grateful that I sprained my ankle and it hurt my knee. And I was already like in the system for my provider. So like when all of this happened, I was already thankfully in the system. So like if you guys don't have a doctor, you should proactively just find something, because when something actually does happen, like the whole process to sign up, to make sure your insurance is accepted, because I ended up going to one of the doctors that was outside of my insurance. So then I ended up having to pay out of pocket for that. And those kinds of things can really, really add up. So I think just finding, you know, just something, and especially now because of COVID, the wait lists are really long to sometimes get like a primary care physician. So even after this happened, it took me almost 4 months to get another primary care physician that was in my area. So I think just kind of having that set up was super helpful. So if anybody doesn't have a doctor or something now, I think that's something that's your homework for this week. Find yourself somewhere that you can go in case of emergency.
Yeah, maintain those relationships. You know, again, I'm a hematologist, so I see somebody, you know, a little bit after the fact, in addition to their primary care doctor. And if your primary care doctor refers you to a hematologist, you know, keep that appointment and maintain ties with them. Most people will see you at least once a year, once every 2 years. And I think it is important to have a long-term relationship like that, because it is a lot easier to text your physician these days. A total tangential thing. We love telehealth in medicine. Absolutely love it. It's great for patients we've seen in the past. It's great to discuss new symptoms. The public health emergency ends soon, and that may affect what happens to telehealth. So, you know, use your platforms to advocate for telehealth as well. Had to put that in there.
This was also a question I had. So there's a blood test that you can do, correct? It's like the D-dimer that you can test if you're having or have had one. How does that work?
Yeah, no, I think that's a great point to bring up, and I'm glad you brought that up, because in most people, people are in the normal range for a D-dimer. And what is D-dimer? D-dimer is a measure of your blood clotted, and then your body's breaking it down. And D-dimer is fragment of an old blood clot that's been dissolved by your body. And so people who have new blood clots have very high levels for the most part. And so I often see patients and they go to an emergency room, and particularly if they've had a blood clot in the past, and it's sometimes hard to tell on the ultrasound of the leg or the CT scan of the chest what's old and what's new. a D-dimer can be so helpful. And a lot of places forget to draw that in the emergency room. So I'm glad you brought that up, because when we have patients who call us and they're worried, they're off anticoagulation now because we, like you, Ariel, with their first clot, it might have been in the setting of surgery, and we usually just treat people for 3 to 6 months. But if they, and we just had this happen yesterday in my practice, and actually this morning, somebody had leg pain, right? So the first thing we do is get a D-dimer. And if it's high, then we go and get the ultrasound of the leg. Or if they have chest pain, we go ahead and get the PECT scan. So it's a great test. Yeah.
Yeah, no, so I asked because, like, was that something that my mom also told us is, like, if you're going to go get a blood test, like, ask for the D-dimer, because sometimes they won't do that. And then even my sister, because obviously we're related, and we think she may actually have thoracic outlet syndrome also, but the nerve kind.
Ooh.
So she was having some chest pains, and so she went in and got tested, and they did a D-dimer, and they're like, okay, no, you're okay. So maybe it's something else, like you're post-COVID, whatever. So it was just great to know that, like, that's something that you can go in and ask for just to make sure.
Yeah. And I think the asking is important. Again, advocating for yourself and your healthcare, because as I said, a lot of emergency room doctors, may not be as aware of the usefulness of the test, or may overlook it. And so it's important. I think it's very, very helpful.
Yeah. And I think also just, you can demand it, but ask nicely, and then just keep asking and be like, look, if something goes wrong and you didn't do this test, like, that's going to be on you. Be like, put it in my chart that you said that I'm not going to do this or do that test, because, I mean, again, like, you sometimes have to take this stuff into your own hands. And I mean, these doctors, it's like, also, we can't blame them. They have tons of patients. They're doing so much stuff. So it's like, yeah, they might not be paying as much attention. They have a lot going on. So I think just, keep on top of it, but also just remember, like, these doctors do have your life in their hands. So just try to be as understanding as possible, and, they'll reciprocate that.
Yeah. But we are still a bit overworked thanks to COVID. So,
even before that, I can't even imagine. I mean, it's just going from patient to patient, like, just even being in the emergency room, because I was in there for so long. It's like the amount of people, because I was just off in the corner, just sitting on my blood thinners, just nothing to do. It's like, I just saw so many people just cycling in and out. And it was just kind of, I don't know, like, really kind of opened my eyes too, of like how much people see and how much trauma they see daily, that it's got to be incredibly overwhelming. And sort of at some point they kind of detach, I feel like, from that, because you kind of have to.
Yeah. And there's a mindset of, in the emergency room, very early on, sort of triaging and making a decision. This person can go home. This person needs to be admitted. This person, we need to figure things out a little more. And I do think that the D-dimer can actually help the physicians in the emergency room or the urgent care center. I've often seen, somebody go to their primary care doctor, and the primary care doctor gets a D-dimer, and it comes back a few hours later. And then they panic too, right? And it's like, oh my gosh, you got to go to the emergency room. You might have a blood clot. So it's an important test.
Thank you both. So we're in our last few minutes. And what I like to do at this time is lightning round, because we have a lot of awesome questions from our viewers. And so we're going to try and get to as many as possible. I will say before I do that we did have a viewer share, the winner of viewer, Sophia, shared who her support system was, and it was her husband and her 2 amazing adult boys. They are her primary support system. Congrats, Sophia. You get a t-shirt. And thanks for sharing, and shout out to your support system. If anyone else has any tips for your mental health, or how you made it through your clot experience, feel free to put them in the chat. Encourage one another. We love to hear those. All right, lightning round. Shorter answers, but still the goodness of them. All right. Justine, can you talk a little bit about any anxiety you may have felt around being on blood thinners and getting your period, how menstruation was for you?
I mean, I was just like, what's going to happen? Like, I was asking so many questions. I was even asking like when I got out, I was like, can I get Botox? Like, what can I do? Like, I was like asking all these crazy questions. Like, can I get a facial? Can I shave my legs? What's going to happen during my period? And for me, like, honestly, everything was normal. The first couple of days, I felt kind of like a metallic taste, which was kind of weird. But then, I mean, everything was fine. I had no issues. I did feel like I was bumping into things more just because I was so cautious. And the first time I hit my head on like a cabinet, I was like, I gotta be watched. I'm on watch. But no, I mean, honestly, everything was fine. And I really had no issues. Everything was very, very normal.
All right. Some people will experience heavier periods. They've noticed them, but it definitely depends on the type of medication you're on, I think, and how your body responds. But if it's getting too heavy and out of control, talk to your medical provider and make sure you're on the right anticoagulant. All right. Jean, how does a person's weight impact their likelihood to get a PE? Slash, I'll insert, can you just list some risk factors to get a blood clot in general?
Yeah, no, weight actually is a risk factor, and we look at body mass index, and there are calculators online that from a variety of different places where you can calculate your body mass index. A body mass index over 30 has an increased risk, and over 35 an even higher risk, about a 2.5 times to almost 3 times greater risk of getting a blood clot simply because of your weight, compared to somebody who's in the normal weight range. So absolutely, I've had patients lose weight because it decreases their risk for getting a recurrence in order to come off anticoagulation. Other risk factors include having your leg in a cast, having surgery, particularly abdominal pelvic surgery or joint surgery, having cancer, being pregnant. Pregnancy is a high risk for getting clots. So there are a lot of, and then there's some other disorders that predispose.
Thank you. This one's also for you, Jean. So medication can be super expensive without insurance. Do you have any tips or recommendations for people who can't afford their anticoagulants? And what do you tell your patients?
Yeah, no, this is a battle we fight every single day. And it's with insurance companies that cover some drugs that don't. Medicare and Medicaid, if you're enrolled in those programs, absolutely will cover drugs. We sometimes have to battle with them to cover the newer oral drugs that don't need monitoring. But warfarin is pretty inexpensive, and it is covered by Medicare and Medicaid. So if you need long-term anticoagulation, even just for a couple of months, there are ways to do that. There are also websites out there that will help you find cheaper cost, and healthcare groups, healthcare providers, physicians. We have resources. We have social workers. We have prior authorization processes for people with insurance, but we have ways of getting drugs for people that need them. You just have to let your provider know, and you really have to have that relationship and let them know. And we've seen, some drugs, like if you need warfarin, the Lovenox that you need for the week to transition over can sometimes cost thousands of dollars. So let people know.
Thanks for that. Justine, this one's for you, and I'm modifying the question a bit. How have you had to adjust your travel schedule? And then I'll put in parentheses anything you have to do to kind of travel differently or prepare yourself differently.
I mean, I kept asking my doctor, like, when can I travel? And I really kind of waited until maybe like 2.5 months. So I didn't travel for a while. So I waited. And I mean, I'm kind of back to a travel schedule now. And I'm not on blood thinners, but I do always have them with me just in case I need to go back on them for some reason. And obviously I wear like compression socks as well, which are definitely something that you can just get on the internet and just Google compression socks for flying. So I did do a very long, it was like a 34-hour travel day. And it was just like, I could already not only was I super anxious, I was like, okay, I got to wear my compression socks. I've got my medication just in case. I was making sure I was drinking a ton of water and just trying to stay hydrated. And obviously I try to walk as much as I can, even, when I'm on the flight. I'm like, I'm going to keep walking up and down this aisle until somebody yells at me. But pretty much I've been going back to my travel. I haven't been doing as much of my lightsaber training, and I try to avoid doing any kind of like overhead lifting and being very careful about what I do at the gym, just because knowing what I think caused it, I'm trying not to do that until I get the rib removed and go through that recovery process.
I love that. I always share the same travel tips. I started having an aisle seat, which is something I never used to do. I used to be very much a window person, but now I'm all in the aisle because I'm up and down, walking, walking, walking. I'm like, I set a timer on my watch because I'm anxious. My second clot did come after a flight, to your point, Jean, about like that worry about flying again. And so walking, walking, walking. Compression socks can be painful, but yeah, I don't know. They're great. Um, all right. So, last question, and Justine, I'm throwing it to you. What advice are you giving to blood clot survivors out there, to anyone who's just interested in hearing more about your story? But what advice are you giving?
I mean, I think I talked about it a little bit earlier, just knowing what your normal base rate heart rate is, your blood pressure, and those things, because that's very, very important, especially if you start feeling kind of out of whack. And I think just advocating for yourself if you're at the doctor's. And if you ever start feeling these symptoms, like the swelling or like a weird pain, you can kind of think it might be something else, but the fact that, I mean, the statistics of like blood clot deaths is so high that it was really scary for me to find out, because I didn't even realize that. And the fact that a blood clot can break off, go to your lungs, can go to your heart, can go to your brain, I think was really scary for me. And I think just bringing more awareness to it, if anybody out there has these symptoms, or if you have friends or family members that are also having these, go somewhere, go to the ER, go to an urgent care, and get the help that you need. And just, again, advocate for yourself. You know your body better than a lot of doctors do. So if something doesn't seem right, if that doctor doesn't listen, go find another one. And just, again, know you're normal, I think is the most important thing.
Awesome. Thank you so much, Justine, and so much, Jean, for being here. We are at the end of our session, but before we close out, we would like to thank you both and thank everyone for celebrating World Thrombosis Day with us. We were so honored to have our U.S. patient advocate with us, and hope that you continue to join us as we enter our 10th anniversary next year. As we leave you today, thank you for sharing your journey with us. Today is the global day for us to raise awareness, but we can't do it without you and your stories and your support. So thank you as we continue to raise awareness for blood clots together so we can reduce the death and disabilities caused by this condition. As we leave you today, we kindly ask all of you on today's call to download our social media image so that you can drop it in the comments and post it on your page in support of World Thrombosis Day. And don't think I forgot about those gift cards. We randomly selected 4 people for giveaways throughout the time. So you will get your gift cards from Apple, $50. And so check your DMs if you haven't already. And please visit worldthrombosisday.org for more information, resources, and to get involved with the campaign if you haven't already. Partner with us. It's free and easy. Thanks again, everyone, and have a great day, evening, night. Good night, everyone. Bye-bye.
Bye. Thank you, everyone, for watching. I see your comments. We appreciate you.